Hello there, Mr. Patient. I am Dr. Tyler. So nice to see you again today. Today we'll be doing an abdominal examination. So just to first start out, I'm going to have you just please raise your shirt up to near the nipple line if that's okay with you. I'm going to start with an external observation, looking for symmetry, any masses, edemas, hair patterns, scarring, anything concerning any, as I said, masses, lumps, anything like that. Everything seems to be normal. Next, we are going to move into, if I did see a mass, I would have you turn your head and cough just to see if it was anything related to a hernia. Next, moving into the auscultation portion of the exam, I'm going to start out by listening for 30 seconds with my diaphragm on the quadrants of your intestines. So, I come and I'm, as I said, listening for about 30 seconds, just listening for orthorhynmy and the normal intestinal sounds. I should hear between 5 and 34 per minute. Again, it would be 30 seconds in each quadrant. Started with the lower right quadrant, moving to the right upper, moving to the left upper. To the left lower, bowel sounds do sound pretty normal, not hyperactive or hypoactive, so that is definitely good. All right, and then coming to listen to the liver and gallbladder, just looking for, see if I can hear any rubs or any bruise, which could potentially indicate enlargement of those organs, or at worst case scenario, some type of liver cancer. I'm not hearing anything, and then I can do the same thing for on the other side, listening to the spleen coming down that axillary line near the lower 2 ribs. I'm not hearing anything there. Next portion of the exam, we will move into percussion. So we will first start by going down the anterior, axillary, midclavicular, and midsternal, and then doing that bilaterally. So I'm just going to start up here. Sorry, my hands are a little cold. Try to warm them up for you. Hopefully this isn't too traumatic. I'm trying. All right. Woo-hoo. Listening for a type of dull sound over organs and everything to a more resonant sound over air-filled substances such as the intestines. That's definitely becoming very resonant down there, starting near the xiphoid process of the midsternal line, coming down. So far nothing is abnormal sounding at all. You might have to poop. Okay, and then I can do that for finding the liver as well. So I'm going to do the same thing, percussion, and I'm going to look for the upper and lower margins of the liver. So I'm going to start up here near the right on the nipple line, going with resonance until I can hear a dullness. So right around here, and then starting very low, coming up until I hear that same dullness, indicating the lower margin, right around here. And then I would be able to measure that, and we really want to see somewhere around the 6 centimeter to maybe a little bit larger than that. And then for the spleen, I'm not seeing anything protruding or anything, so splenomegaly probably need to see 3 times as large of a natural spleen to even see that, but we can do the same thing and kind of palpate, so go ahead and, okay, and then take a deep breath for me. All right, and it's the same. That deep breath would have then lowered the spleen, but the sound stayed the same. Not thinking that we have an enlarged spleen or anything like that. Moving on to palpation, we are going to start around the quadrants again of your intestines. We're just going to do start with a very light pressure, checking for masses, checking for any abnormal, stiff feeling organs or portions of anything. Good, and then we go into a little bit deeper. Let me know if there's any pain associated with any of this palpation. Deep. All right, and again, go ahead and take a breath in for me. Go ahead and let it out. Dig in, I'm gonna palpate under the rib cage to go to that liver, so it's a little tender. That felt good. Then I can have you breathe in again. Same thing for the spleen, I can try to palpate that. Coming under near those second or 2 lower ribs. Do bimanual palpation for kidneys, so I'm coming under the back, bimanual palpation, and then I would do that bilaterally. Let's see what else. For the abdominal aorta, coming in here, compressing, it's going to be a little uncomfortable. And I'm essentially going to try to find the lateral edges of the abdominal aorta, should be right around 2 centimeters. Don't want much larger than that. And I can feel the heartbeat now, and that seems like it would be right around 2 centimeters. I did miss just a couple small portions in the auscultation. We're just going to quick go back. Abdominal aorta, iliac, femoral, and renal just very quickly. So again, be using the bell for that. Abdominal aorta, we do all these for just a few pulsations. Go to the renal. Going to near McBurney's point for the iliac auscultation. And then is it okay if I just place this bell right on your femoral artery? And I don't want to be hearing any bruise or anything like that, and I do not. And then for special tests to end this examination, I am going to go ahead and apply pressure on your lower left quadrant and release quickly. Was there any pain anywhere associated with that? No, if we saw pain in the lower right, that could be indicative of appendicitis. Now I'm gonna go ahead and have you raise up this leg and resist my pressure. Really working that psoas, and again, acute appendicitis would really make that flare up, and that would be painful, and resist my pressure. Same thing with that obturator test. Any pain with that? Good. We're not assuming acute appendicitis. Way to go. The examination is done. Thank you so much, Mr. Patient. You were wonderful.